For this injection, the following armamentarium will be needed: a yellow cassette with a mouth mirror and cotton pliers, a needle capper, a syringe, 2x2 cotton gauze, 25 gauge long selection, a cartridge with solution appropriate for the patient with or without epinephrine, 20% benzocaine topical anesthetic, and optional Q-tips. Before administering this block, the cartridge must be loaded with the top portion in first. Be sure that the barcode is pointed away from the large window and the clinician is able to clearly read the information printed on the cartridge through the large window. Provide one strong twist of the syringe so that the harpoon is engaged, and never pop the harpoon with the palm of your hand. Check that the harpoon is engaged by carefully pulling back slightly on the thumb ring. Carefully twist off the bottom portion of the needle and attach it to the head of the syringe. Twist the needle into place until snug. Be aware of bevel placement for your specific injection. For the Gauge-Gates block, the nerves anesthetized are the inferior alveolar, the lingual, the incisive, the mental, the mylohyoid, the auriculotemporal, and the long buccal nerve. The areas anesthetized are the mandibular teeth and the periodontium to the midline in one quadrant, the buccal and lingual gingiva of the anesthetized teeth, the floor of the mouth to the midline, the lower lip and skin of the chin to the midline, the anterior 2/3 of the tongue, the temporal region, the skin over the zygoma, and the posterior portion of the cheek. For this nerve block, the extraoral landmarks are the intertragic notch and the labial commissure. The intraoral landmarks are the mesiolingual cusp of the maxillary second molar and the buccal mucosa just distal to the maxillary second premolar. The proper hand placement for the Gauge-Gates will lie between the intertragic notch and the labial commissure. At this point, apply the 20% benzocaine topical anesthetic to your insertion point. For this injection, we will be using a 25 gauge long selection and administering 1.8 milliliters of solution at a depth of roughly 25 millimeters. The point of insertion will be at the buccal mucosa on the medial surface of the mandibular ramus, just distal to the height of the mesiolingual cusp of the maxillary second premolar. We will be aspirating 2 times. The Gauge-Gates block, you will be administering 1.8 milliliters of solution, which will look like this. Be sure to thoroughly rinse your patient and dispose of the needle and cartridge in their respective bins. Let your patient know where they should be expecting numbness to occur. Post-operative instructions should be provided to the patient by the clinician, such as, while numb, please be careful not to bite your lip, cheek, or tongue. No hot temperature food or beverages, no crunchy foods. Please stick to a soft food diet until the numbness wears off. For the Gauge-Gates, be sure that your patient keeps their mouth wide open for 2 minutes.